Today, joining me is Don Sin, who is a Queensland recipient of the Credabl Financial Hardship Scholarship. Don is in his fourth year at Griffith University Dental School. Don, would love you to start off and tell us a little bit about yourself.
Sure. So, as Simon said, I'm a fourth year dentist student at Griffith University. I was born in Korea, moved to New Zealand when I was quite young, and then to Australia pretty soon after. I've lived in Sydney, Melbourne, Korea as well after I first graduated. While working at Melbourne, I noticed there was a pretty high turnaround rate at the office I was working at. I remember speaking to one person, probably only worked maybe about a couple of weeks, and he said he wanted to leave, he wanted to quit already. At the time I was really surprised. I asked him what he was going to do now that he's leaving the job, and he said that he wasn't sure, that he'd take some time off, but the job wasn't for him. That was really surprising for me at the time, because I was always the type of person that needed to be quite sort of planned out. So it was a real sort of surprise to me that he was so confident and certain of himself, because I was working at that company probably for around 2 years' time. Around that time, I also took a trip to Thailand as well. It was really eye-opening, because I remember seeing people that were living below means, but they were happy. They had the biggest smile on their face. They were really sort of living life to the fullest. So it really sort of made me humble, and sort of maybe question where I was sort of headed towards in life. I was working in an office. All my problems were sort of first world, like the aircon's too cold, coffee's too hot, that sort of thing. But over in Thailand, you have people just living off a couple of dollars a day, and they're still happy, enjoying life. So it was a really humbling time. So it really made me put things into perspective, and wanted to take control of my life, help more people out, give me more confidence in life, and give me a challenge. Before that, I also co-owned a club in Korea, was a photographer as well for a couple of magazines. So I had my hands in a couple of pockets. But dentistry was a pretty sort of sudden thing when I was living in Melbourne. It was one of those things where I chose to sacrifice a year. I stayed at home pretty much, sort of 2 friends throughout that year, just studied every single day. Yep. It paid off at the end, got into dentistry, so it was a good sacrifice.
Good story. Look, you probably touched on this a little bit, but understanding from your application for the scholarship that you've got a firm belief that oral health should really be a right and not a privilege.
Of course.
You kind of touched a bit on that, I guess, in your own philosophy from your travels, but Did you want to just expand on that viewpoint a little bit?
Yeah, I mean, at the uni clinic now, we see patients every day. Most of the patients that we see, they're mainly from families or areas that wouldn't really see a dentist regularly, or would only come for emergencies. And even yesterday, I had a patient that sort of realized that to save time and money, she avoided the dentist for years and years, and now the issue that she had became so sort of complex that she ended up needing to pay more money in the long run, if that made sense, rather than sort of just doing those sort of regular visits, which would have been free for her actually.
Yep.
So she ended up paying a lot more upfront in one sort of lump sum, and a lot more than she would have just saved, rather than sort of doing those maintenance visits. But just sort of educating the public that if you just spend 2 minutes a day brushing your teeth, it can really help avoid a lot of diseases that you could get, such as cancers, blood diseases, because the bacteria could really easily get into the bloodstream, because your mouth is obviously an entry point for food and bacteria. So I mean, a lot of people think of the dentist as sort of as a emergency sort of stop that you'd only really go when you need a problem, but it's pretty important to take sort of regular appointments just to make sure everything's under control, because a lot of those things are reversible and easily fixable as well. Those small sort of regular checkups, especially at a clinic, are free as well, which a lot of people I think don't realize. So a lot of opportunities for people if they're sort of motivated to look after themselves.
Yeah, definitely. So I guess expanding on that a little bit as well, periodontal disease is a common cause of so many other non-dental related illnesses, like you say. And I'm told from your career plan is that you're going to do a little bit of research and development on sustainable technology in this space. What does that mean?
So for our degree, our master's program, to graduate, you need to write a research project. I've been sort of blessed to have a lot of really good supervisors, especially in the periodontal field. It's really interesting because it's a pretty large scope, periodontal disease. As mentioned, because the mouth does have a lot of spaces that the bacteria can sort of hide in. How sort of periodontal disease works is your teeth is connected by your gums by fibers, and usually there's a small sort of space, about 2 to 3 mils, and when you maintain that, it stays at that 2 to 3 mils, so your teeth sort of stay stable. But if you neglect brushing your teeth, food, bacteria can sort of get stuck in those gaps and eat away at the fibers, making your teeth a bit more mobile. And it sort of creates a cycle where once the pockets get deeper, it gets harder to brush, more food gets stuck, it gets eaten away more. And sooner or later, your teeth could fall out. There could be an infection leading to diseases and so forth that can enter the bloodstream and end up doing a lot of damage. So I think it's really interesting to me because, like I said before all of that happens, there's sort of a transitional stage where it can easily be reversed, even just by brushing your teeth at home regularly. And with the innovation side of things, the dental side, dentistry tends to sort of evolve quite slowly. It's still relatively new. I remember I had a patient yesterday. He was saying that the first dentist he went to a couple of years ago had a drill that was run by a pedal. So pretty old technology. So I think I really want to emphasize on bringing new technologies and innovations to the public, because within industry, obviously, there's a lot of innovation and new technologies, but it doesn't really get trickle down to the public. So just communicating that to the public, letting people know that there are new sort of innovations. And I mean, it's not always a lost cause. A lot of people think once their teeth get to a certain stage, it's done for, and they just extract the teeth, or they sort of lose a lot of hope. But I think, there's a lot of innovations going around that would sort of make a lot of things that wouldn't have been possible in the past, doable. So,
Sure, that's awesome. And so what has the Credabl Financial Hardship Scholarship meant to you so far?
I'm really grateful and thankful that Credibl's given me an opportunity to support me. For myself, I'm probably no different to most of the students that I study with the exception of some students that may be a bit more fortunate to be supported by the family, and a bit more well off, that they don't need to worry about things such as rent or food or basic necessities such as emergency costs that may come up. But for me, my partner has been overseas for about a year now. She went back to Korea just after the peak of COVID to get some dental work done that couldn't be done here. So I've been sort of, you could probably see a suitcase in the back, living at sort of share house to share house, close to university. She's coming back later this year, so we'll be looking for a house together to rent. And she's been very sort of supportive, supporting me sort of mentally, as it's been sort of quite difficult with COVID and just dentistry in general, and supported me financially as well. My parents have not really been in the best position to help me financially, but they've been very loving and supportive and tried their best to obviously give me a helping hand. But I feel very uncomfortable asking either of them for sort of help. I do really want to be more independent, and obviously once I graduate, I'll be able to give back and support them financially. So just working during the holidays, just living very sort of simply. But even now with the scholarship, I've been able to buy sort of equipment that I've been putting off that would really help me with my patients as well. So just sort of reinvesting in myself, looking at courses as well that would count towards sort of like surgery courses or endodontic courses about root canals and braces. There's a lot of extra courses available. So yeah, looking at those as well to definitely reinvest in myself and give back and help patients on.
Yep. No, I'm glad to hear that it's having such a positive impact to you, and really nice to hear that you've also got that non-financial and that emotional support in the background as well, which obviously through COVID we've all needed. So when you do graduate, what are your plans? What's your first move, do you think?
Yeah, it's still pretty open at the moment. With dentistry, the great thing is, particularly in sort of rural areas where there may be not enough infrastructure, there's a high demand for dentists, and the water quality or the diet may not be as great as in the sort of more urban areas. Our school has a pretty good program as well, where they offer graduate students to come and supervise for 6 months to a year, which would be a great way to give back to the community as well. I've been a class rep for 2 years, as well as heavily involved in the Dental Association. So giving back to the community, I think, is really important, obviously, to keep yourself humble and not to sort of keep everything to yourself. If you're not working, I think giving back to the community in some sort of way is definitely important. Eventually, I'd love to open up my own practice. After being comfortable, I'd love to sort of open up my own practice that has a more patient-orientated focus. A lot of dental clinics these days tend to be sort of factories where they go and pump out short appointments, so the whole day is just seeing appointment after appointment after appointment. And I think that's not ideal, as it doesn't really give you a good opportunity to focus on the patient. I remember a lot of supervisors saying they had little contracts for the government or in rural areas where they would see maybe 20 to 50 patients a day, and afterwards they'd be so tired and they wouldn't have any recollection of the patient history or like the work they did. So I think dentistry isn't always about just repairing people's teeth or giving education. It's also about building that rapport and explaining to patients that taking care of their teeth is more than just brushing, things such as like eating properly as well, cutting down on smoking. There's a lot of different factors. So I think just communicating that to patients is a really sort of important way of the future. Prevention is also equally as important as the treatment as well. So I think that's a really good sort of emphasis to focus on.
And you also talked a little bit earlier about the coping mechanisms financially, I guess, you've taken to get yourself through to this point. What tips would you have for other young people who are considering a career in dentistry but have that concern around the financial commitment and the ability to carry that through?
Sure, of course. I think there's a lot of services available that people aren't aware of. I remember when I studied at a different university, they had a scholarship program that had a pretty high success rate. The reason being was not many people applied for it. Yep. So I think just knowing the fact that there are support services available, such as Credabl Scholarship, university sort of bursaries as well. But knowing that 5 years is a pretty short time frame, especially compared to other sort of courses like medicine, for example, you'd be studying far more than 5 years, and then you'd be, I guess, on call and sort of still struggling financially as you're paid sort of as a sort of entry-level doctor. Whereas with dentistry, you after the 5 years, you can start working immediately or open up your own clinic. So you get to pay off your studies much faster. So I think I would highly recommend dentistry. It's really one of the things that I really don't regret at all in terms of my choices. It's very technical. There's a lot of knowledge that you need to know. Your people skills really come into play. You can't just sort of fall back and rely on just one skill. Everything sort of comes into play. So it's a really fun and really challenging course, and I highly would recommend it.
Yeah, great. Well, Don, look, it's been great having a chat and getting to know you a little bit over the last 15 minutes or so. And again, as you touched on at Credabl, we really believe in helping dental professionals access the tools that they need to enable them to do what you do. And this starts at the very beginning of your career and ensuring to help you get through your studies and then with as few financial burdens as possible as you go through that. So we do look forward to watching your career flourish and hopefully into your own practice one day. And we look forward to hearing how your ambitions come to life. So thanks very much, mate. Congratulations.
Thank you. Appreciate
it. And look forward to chatting more as you get through your studies.
Thanks, Simon. Appreciate it.